Good morning, everyone. It is 10:15, so I want to make sure we get started so that you have time to go ahead and take a break between this workshop and the next one. I also do want to apologize ahead of time. Allergies have really gotten to me this morning, so because my camera's on, you might see me cleaning my face off. So I just want to throw that out there ahead of time so you know what's going on. But this morning, I know you had options as far as which workshop to participate in. So I appreciate you all attending the workshop that I'm presenting today. Like Brian mentioned, this workshop is called Preparing Your Workplace for Peer Integration. So let's go ahead and jump in. So a little bit about CalVoices, which is the organization that I work for. We are a nonprofit 501c3 public benefit organization. We are an affiliate of Mental Health America. We're founded in 1946, so we're the oldest continuously operated peer-run advocacy agency in California. We have over 78 employees, 98% of which have personal lived experience as a consumer of behavioral health services, a family member of a consumer, or both. And over 15 of our programs provide direct peer support services, whether it be within wellness centers or as part of clinical multidisciplinary teams or warm lines. We have peers in lots of different settings. We also do, legislative work, public policy analysis. Like today, we provide training and education to individuals as well as organizations and peer employers across California. Like we mentioned briefly, my name is Stephanie Ramos. I am the education director here at CalVoices. I've been here for over 17 years, where I started as a youth advocate as part of a multidisciplinary team serving youth in Sacramento County. And I work in the field because I have a sibling who's now an adult who has severe mental health challenges, received services through the public mental health system, and as well connected as I am working in the field and knowing who's who and who to contact, we still run into challenges and barriers when it comes to services. And so I think recognizing the challenges that other individuals and community members are experiencing when they don't have those connections is really what has kept me around continuing to do this work. So let's jump into why you're here. As a manager or supervisor, the fundamental purpose of your job is to bring about specific intended and desired results in your program, right? That's the fundamental purpose, to get things done. You have an affirmative duty to protect the agency against any foreseeable risks. And you need to know your contract, your scope of work, deliverables, work plans, timelines, and your budget inside and out so you can understand what outcomes you're expected to produce, what it'll take to achieve your program's objectives, and how your team will accomplish this together, right? Together, including our peer staff. So when we're talking about intended and desired results, you are the ruler of your realm. So the performance of your staff, so the ability for them to do their job well and complete tasks on time, directly reflects on your skills as a manager. To accomplish meaningful results, you need to know the exact outcomes expected of your program and how to accomplish them within the parameters identified in your contract, and what tasks and job duties are required to complete your program deliverables, how you're going to assign them, and the skills and attributes employees need to effectively perform them, right? So if you already have staff, these are things you want to figure out. If you're starting in a new program, these are things we want to really try to do a good job of nailing down before we're writing job descriptions and things like that, because we want to know what skills and attributes are we looking for in our employees. Part of our role is also risk avoidance and mitigation. So when we're talking about affirmative duty, you are actively on the lookout for possible problems and potential solutions, and you are going to address issues proactively, not reactively. The other term I used was foreseeable risk, right? So these are things where they're predictable, regardless of how likely or unlikely they are to occur. If the folks above you have ever mentioned it, then that means that risk is foreseeable and you're expected to recognize and take steps to avoid it. And many employment-related problems are easily avoidable if you draft and adhere to effective job descriptions, right? I love to ask everyone, when's the last time you looked at your job description? Might have been a while, but that is really what guides the work that we do. I just want to refer to the chat real quick. Someone asked if you all will get the slides. Yes, as soon as I'm done sharing So at the end, I'll go ahead and pop that in the chat, and I'm going to send any handouts to Brian, and we're going to work on getting all that information sent out to you. So we've developed a checklist for success. 6 items. So you want to assess your organizational competencies and work culture. So sometimes we expect our employees to come with certain competencies to fit in with what with what we want from them. But as employers, especially as peer employers, there are certain competencies and a work culture that we want to create to really ensure that we're bringing on staff in a way that is, inclusive, supportive, that they feel a part of the team, that we're, incorporating recovery-oriented outcomes. There's a lot of things that go into assessing where are we as an organization. We want to work with our existing staff. Hopefully before we bring in peers, it might be after, but we want to work with them. We need their buy-in, right? We want to use a slow and methodical integration process. So checking all the boxes before we bring peer staff in, develop new programs and things like that. Ideally, we want to hire more than 1 peer per program, and we'll talk about that in a moment. We also want to ensure that peers make living wages and have opportunities for professional growth. And we want to ensure that peers have a direct line or report directly to a high-level administrative staff member. One of the handouts we will get sent out, or at least will be available to you, is a document that we created where we identified core competencies for peer employers. So if we had all day, we would go through all of those things. But since we only have 45 minutes to an hour, that is a handout that you will have a great time checking out during all of that free time that I'm sure you all have. So let's start with number 1, assess your organization. So think about this, like, is your agency and team willing to address and make genuine efforts to overcome common challenges and barriers to peer integration? Are we willing, right? Let's start there. Does our agency or team understand and value the peer role? Do we understand the core competencies? Do we understand the scope of work that they'll be working within? Do we understand what peers do and what peers don't do? Right? Do we understand the value? What benefits do they bring to the team? We also want to identify, does our agency or team possess and demonstrate the 11 employer competencies, which again will get sent out to you all. And does your agency and team foster and promote psychological health and does your agency and team foster and promote a psychologically healthy and safe work environment? And that's for everybody. A lot of these things often apply to everybody. And so let's jump into the second item on our checklist. Well, before we do that, so there's 3 necessary qualities when we're looking at organizations and really ensuring that our work culture is recovery oriented, right? So a recovery oriented work culture is essential to peer workplace success. So when we're looking at recovery oriented, it is person-centered, right? So there's a broad focus. We're looking at all of someone. We're being goal-driven. Services really focus on helping someone build their whole life, rather than an illness-centered focus, where maybe we're narrow in our focus. We're looking at diagnosis. We're symptom-driven. Services are treating illnesses and eliminating symptoms, right? So which side are we on? Are we being client-driven, where we're looking at individuals recognizing that recovery comes from the inside out, it comes from them? Are we individualizing our care? Are we working in a way with our clients that it's really about collaboration and partnership? Or are we being professionally driven, where we give them recovery, right? Where treatments and services are more formulaic, and that we focus a lot on compliance or coercing individuals to do things. And then when we're assessing, whether or not we have the necessary qualities to bring in peers and thinking about a workplace culture, are we strength-based? So are we building on what's right? Are we developing resilience? Are we honoring independence and personal empowerment? Are we positively reframing experiences? Or are we deficit-based, focusing on fixing what's wrong, or rescuing people because we can't bear to see them suffer? Are we, encouraging reliance on professionals in the system? Are we pathologizing what people are experiencing? And one of the handouts we'll make sure you get is a recovery self-assessment. So really figuring out where is our organization as far as recovery orientation, right? And how are we becoming more recovery oriented, which in turn will create a more inclusive and supportive environment for our peer staff. So how recovery oriented is your workplace? You can think this to yourself, you can pop it in the chat if you feel like it, but what are some things that are going well in your workplace when we're thinking about recovery orientation? What are some things that could be going better in your workplace? And what can you personally do to improve the recovery orientation of your workplace, right? So things to be thinking about. And I know we haven't gone in depth into recovery orientation, but we will get a handout sent to you where you can do that self-assessment and just kind of think broader when you're thinking about recovery orientation, right? It's not just the signs that we have on the wall, right? But it's how we talk to people, how we treat people, how we include them in decisions and choices that we're making that may impact other people. So along with assessing our workplace, we want to think about psychological health and safety. So are we a recovery-oriented workplace, and are we a psychologically healthy and safe workplace? So psychological health is about our ability to think, feel, and behave in a manner that enables us to perform effectively in our work environments, our personal lives, and in society at large. And psychological safety is about dealing with the risk of injury to psychological well-being that an employee might experience. And it's important to note that psychological health problems occur on a spectrum, right? From mild difficulties on one end to severe disorders on the other. And the most common psychological health problems in the workplace are anxiety and depression. And these conditions account for a large proportion of the negative impacts on employees and employers. And when we're thinking like, well, what is the risk? What puts people at risk for a psychologically unhealthy work environment, a psychologically unsafe work environment, puts us at risk for developing some type of condition because of our workplace. So those two biggest risk factors are having high demand and low control. There's a lot of demand on me, but I don't have control over how that work gets done. The other risk factor is high effort and low reward. So I'm putting in all this effort and maybe my coworkers aren't putting in very much effort at all, and we get the same reward, same acknowledgement, right? Why am I putting on all this effort if no one's gonna notice, right? Or it's not making a difference. And so thinking about, what does that look like within our workplace? Like thinking about fairness, right? That's a big thing across employees. When people feel like things are unfair, right, that affects them internally and how they're feeling, sometimes those minor things at work might affect them. So a psychologically healthy and safe workplace is one that promotes employees' psychological well-being and actively works to prevent harm to employees' psychological health due to negligent, reckless, or intentional acts. So what is the risk of having an unhealthy or unsafe work environment? So it could affect you legally or your reputation. So we could be dealing with harassment, discrimination, bullying, work comp claims, lawsuits. On the business side, we might see a loss in productivity or absenteeism, presenteeism, a decline in the quality of services, maybe a decline in the quality of engagement between employees and clients. We might see burnout, turnover, lack of sustainability, lack of growth. We might have morale issues. And then as far as health for our staff, we might see higher rates of disability, stress, trauma. There may be the creation or exacerbation of mental and physical health conditions, right? These can all happen because of an unhealthy or unsafe work environment. And, we spend over 90,000 hours at work in our lifetime. 90,000 hours. So what happens at work has a huge impact on us, right? A lot of us spend most of our waking hours at work, away from our homes, away from our families, often in an environment that we don't have control over, right? So as employers really thinking about that, people are spending most of their time here, and how are we creating a safe environment for them? So there are 13 psychosocial factors And psychosocial factors are elements that impact employees' psychological responses to work and work conditions, potentially causing psychological health problems. And psychosocial factors include the way work is carried out. So deadlines, workload, work methods, and the context in which they occur. So that includes relationships and our interactions with managers and supervisors, colleagues, coworkers, clients, etc. These 13 organizational factors have been identified by researchers at Simon Fraser University and are shown to have the greatest impact on organizational health, the health of individual employees, organizational costs, including the way work is carried out and the context in which work occurs, right? So I'm going to briefly go over these psychosocial factors. So do we have psychological support at work? Is there a positive organizational culture? Is there clear leadership and expectations? Do we have civility and respect in our workplace? Is my job a good psychological fit? Are there opportunities for growth and development? Do we have recognition and reward when we're doing a good job? What type of involvement or influence do staff have over, decisions that are made within the organization? Do we have really good workload management? Are employees engaged? Are we encouraging work-life balance? Are we ensuring psychological protection and physical safety? So the workplace has a crucial role in at least protecting and possibly promoting dignity and respect of a person. So serving basic needs for the sense of self-worth and self-esteem. We need to be promoting security, integrity, and autonomy of the person. So really ensuring and serving the need for individuals to feel both physically and psychologically safe. And are we promoting organizational justice? So this is really serving the need to feel that someone belongs to a community where there is respect for due process, for fair procedures, people trust where they're working. So to one degree or another, the 13 psychosocial factors listed all revolve around the protection and promotion of kind of those three major clusters of needs, right? Dignity and respect, security, integrity, and organizational justice. And you will get another handout. So there is a website called Guarding Minds that you can check out, and they actually have a start to finish like assessment and action plan as far as assessing your psychological safety within your workplace. And one of the handouts that we're going to send you is it is a document where you can go in and you can do an organizational review. So overall, organizationally, how are we, addressing these psychosocial factors? If you decide you want to dig deeper and you visit the Guarding Minds website, they have an organizational assessment. They have surveys and assessments for staff to see like, okay, well, what is the staff's perspective of these things? And kind of what I was saying, kind of action plans based on that information, things that you can do within your organization to increase that psychological safety. So think about it. You can think about it, or you're welcome to put some information in the chat. We would love to hear from you. What are some things that are going well in your workplace? What are some things that could be going better in your workplace? And what can you do to personally improve psychological health and safety in our workplace? I briefly wanted to go to the chat. The questions we asked previous to this were around recovery orientation. And Carrie said that our agency is pretty recovery oriented. We talk about wellness and don't use diagnostic language very much. We believe and model that dealing with strong emotions is part of the human condition. We use strength-based language and do our best to be supportive and encouraging, right? And recovery orientation, I think, is important for the sake of our peer staff, our clients, but also looking at the psychological health and safety end too, right? We're spending all of our time at work. Do our staff feel safe, encouraged, supported, included, and all of those things as well? So the second item on our checklist is to work with existing staff. So ideally, before we bring in peers, or if we're bringing in new staff that maybe haven't worked with peers before, or if we've already have peers in our program, we want to ensure that we are explaining the peer role. What is it that the peer does? What are their job duties, their tasks? What are they responsible for? How is, the peer position or what they're doing within their peer role different than maybe a case manager or a social worker or the clinician? How is it different, right? And sometimes we see that peers may have similar tasks, but there is a difference, right? And that we're using our lived experience to model, to share what worked for us, to help build hope. So we want to ensure that we're explaining the peer role. And for some agencies, that means sharing the job description, right? What is it that they're going to be doing? How are they going to work with the rest of the team? We want to explain the employer competencies, which again, you will get as a handout. You want to ensure that you're sharing your vision for the role and the program. It's not just that, oh, we hired a peer staff or we have peer staff now, but what is the vision? Where are we trying to get to? And what is that going to look like, not just for the peer, but as the entire team? We want to gather input and generate buy-in. And that's really important to be able to have that process with the staff, because we know that there is still stigma around, mental health, and there is sometimes discomfort for some individuals in thinking that, oh, wait, now clients are now my coworkers, right? Having that perspective. And so making sure that we're, gathering any of that input, getting buy-in, dispelling any myths, being able to work through whatever issues our non-peer staff are having, so that when we bring in peers, it is a safe environment for them. And with that, we want to address and dispel any common myths related to peers in the workplace. Ideally, before they get there, sometimes we have to do it after. So some of the common myths that are out there around peers working in behavioral health is that peers can't work full time, that they can't provide mental health services, that they will relapse, that they're too fragile to handle job stress, that they can't handle administrative demands, and that peers will cause harm to clients that professionals have to undo. Years ago, an organization called RAND put out a report. It's called Mental Health Consumer Providers, a Guide for Clinical Staff. We'll get that handout to you as well. And it is, they basically go through these myths and literally dispel the myths. They bring truth and really kind of help people kind of get over that misconception that they might have around working with individuals with lived experience. So we really encourage folks to read that, share that with clinical staff, share that with non-peer staff. Again, ideally before we bring in peers, but most likely we've already brought them in. But being able to really foster and grow a safe work environment so that we have individuals experiencing stigma out in the community. We don't want them experiencing that at work, especially when we're spending 90,000 hours in our life at work, right? We want people to feel safe, comfortable, and have their needs met when they are working, especially in the behavioral health field, with all of the stressors that we know can come with this work. The third item on our checklist is to use a slow and methodical integration process. So again, all of this is like ideally before we bring in peers. We know that is not always the case in organizations. So this might be going through some organizational or program transformation as we start to try to tackle this. So we want to adopt a recovery-oriented mission, vision, and values within programs, agencies, and the system, right? Just to start off, are we being recovery-oriented? And not just for our peers, but for our clients. Do we need to modify any policies to foster inclusion of peers in the workplace? Do we need to develop any policies and practices that promote recovery principles and recovery-based outcomes? So it's one thing to say that, oh, this is our vision and our mission and values about recovery. But what we sometimes forget is what we say we value and what actually happens don't always connect with each other. Right. And when values are often, something that we feel, that we think, and then we have these artifacts, which are things that you can see, you can feel, you can experience. Right. So, for example, I was doing a training within a community support team that goes out to the community. They have clinicians and they have peers on the team. All of the clinicians were in private offices, and all of the peers were in cubicles. Okay, but remember, we really value peer support. And then there was an empty office, and it had been empty for 6 months, but no peer could move into there because they were going to save it for when the hiring freeze was over so they could give it to a clinician. So even though we value peer support, we value recovery, we value all of these things, what we see is not lining up, right? What we value is clinical work, advanced degrees, right? All of the medical model. So what we don't want to just have lip service, right? So if we're, if our values, mission, vision are recovery oriented, we're recovery driven, client centered, we need to ensure that our policies, our practices are reflecting that, because that's what tells us, well, this is how we do this, right? It's not just the lip service. We're incorporating it into how we do the work. We want to incorporate peers as equal and essential workforce participants in all aspects of system development. So this says system development, right? So that doesn't mean that peers are only part of the wellness center, that they're only a member of the clinical team. Are they supervisors? Are they part of the management team? Are they included in our quality improvement efforts, right? How are we really looking at and integrating peers as equals within all aspects of our system development? Do we have the peer voice at the table? We need to ensure that we're clearly defining staff roles and responsibilities, right? Again, this is slow and methodical. This isn't something we're going to do overnight, but really helping the staff understand what is the difference within our role and how are we collaborating? How are we really enhancing the services that each other are providing? We want to foster team building and collaborative opportunities, and that would be important for any team. But I think especially as peers, for some reason, we have to humanize people, right? Especially peer staff with their coworkers. So we want to encourage that. We also want to develop an performance improvement framework with providers and peers to improve their knowledge of and competencies in delivering recovery-oriented services, right? How are we measuring it? How are we measuring performance in a way that reflects the recovery-oriented services and supports that we're providing? So with thoughtful integration, we want to think about what programs will peers be working in? Who is going to supervise the peers? What training are they going to get? What duties will the peers perform? What potential barriers to integration exist, right? Sometimes that's a person. Sometimes that's a policy or a procedure. Sometimes that's our hiring processes, right? There could be a lot of things that are barriers to that integration. And what about long-term growth and development for peer programs and positions? Long-term growth, not just right now. Does the career ladder stop at step number 3, right? How are we thinking longer term for these peer positions? Now consider what training will non-peer staff receive. And what we've seen over the years is all these trainings come out and we'll even say like, these are for non-peer staff, and they send all the peers to it. But then we're missing everybody else that actually works with the peer. So we want to make sure that we are figuring out what trainings do non-peer staff have? What recovery-oriented trainings are they going to? Are they going to a training about peer support? What do peers actually do? Learning about the evidence base, the importance of those roles. We want to especially ensure that individuals supervising and working directly with peers will receive training as well. We want to identify what trainings our peers going to receive. Is there a training academy that they can attend? Is there continuing education they can participate in? Are there certain groups that they need a certification to facilitate? So figuring out those training plans for our peer staff. We also want to identify performance expectations. And sometimes we'll have, folks might have an evaluation and things like that, but it's are we customizing it to the peer role and the duties that the peers have and the tasks that they have, and what are the expectations for those roles? So figuring out how are we measuring performance, right? Are there, and I hate to go there, but are there certain like billing percentages that they have to have? How are we measuring that? Are they supposed to facilitate a certain number of groups? Do we have satisfaction surveys that clients are taking? Are they supposed to be, linking a certain percentage of their clients to certain services and supports in the communities? Like what are we expecting from them? And then developing those performance expectations and sharing them with the staff so that it's not a surprise when they have some type of formal performance evaluation, right? They should know all along the way, what are the expectations? How are they being measured? We also want to think about what are the core competencies for peer support workers, and how are we in a way enforcing those so that staff know, hey, no, that's not something appropriate to ask the peer staff to do, right? What are the core competencies? What is their scope? And how are we ensuring that we are as supervisors and managers doing what we need to do so our peers can stay within that scope of work, right? Especially with certifications being out there, like any other certificate or licensure, we have to stay within our scope, right? So we want to ensure that we're honoring that with the peer role. We want to identify how performance will be measured and evaluated, and how to prevent and address any performance issues. So two of the handouts that we'll be referencing are the SAMHSA core competencies for peer workers. And then also, if you're in California, the new DHCS Behavioral Health Information Notice 21-041, which identifies the core competencies for peers in California. So if you're from out of state, your state might have their own list of core competencies. So we want to make sure that we ideally are looking at those things before we're bringing staff on and really incorporating those core competencies into job descriptions. So we also want to ensure, I got to wave at someone because they're being really loud. Oh my God, she doesn't see me. Okay, don't mind my background. So data collection and recovery oriented outcomes is something that we need to look at. So are we creating mechanisms for peers and people in recovery to define outcomes and train people to understand them? Right? What are recovery-oriented outcomes? Do people feel empowered? Do they feel hopeful about the recovery? Do they feel like they can make decisions for themselves, right? So thinking about what recovery outcomes are we looking for? We want to increase accessibility of data by using creative ways to share information. And so I think some organizations are doing a good job of really trying to collect and measure recovery-oriented outcomes and data, but then it doesn't get shared with the world. So then everybody asks, well, how do we collect it? What should we be collecting? Is that actually working? How are they measuring it? And you have some places that are doing a really great job, but we don't always share it. So I think not only are we trying to collect data around recovery-oriented outcomes, but we want to find a way to disseminate that information to really support and encourage other organizations out there that are trying to move in that direction. And then we'll want to increase research into recovery-oriented practices and peer-provided services, right? Really trying to up our game on a regular basis when it comes to providing services in a way that's recovery-oriented. So the fourth item on the checklist is that we want to hire more than one peer in a program. And this really promotes cultural transformation, right? We're having more than one peer. I don't know about some of you, but early in my peer career, I was the only peer in quite a few meetings. And I would say at the time, I was probably not as confident as I am now. And so if I felt like I disagreed with the group, it took a lot of courage for me to speak up because I was the only one. Or maybe I noticed something that was weird, and in my head, I'm like, is it just me? Did that come off? What that person said, was that wrong? I feel like it was wrong, but I don't have anyone to bounce it off of, right? So it was nice to have, as I had worked on other teams, to have more than one peer. So to have someone, sometimes to have my back, right? And someone else that I could kind of bounce experiences off of to figure out, like, was it me or was this actually maybe a larger team issue? We want to provide peers with necessary peer support. Often in programs, there might be more than one clinician, more than one social worker, more than, and within those clinical roles, they're often well-defined, and people I get what a social worker does. I get what this person does. But with peers, that's not always the case. And so we want to ensure that peers have support as well. And that might be, again, hiring more than one peer in a team. If you have multiple peers in your county, maybe setting up a committee or monthly meeting where all those peers can kind of come together, talk about systems issues, right? Trends that they're seeing, trainings that are helpful, what's working for them within their organization, within their peer role. We want to strengthen and reinforce the peer identity, right? Do our peer staff have mentors that are in peer roles, right? People that have similar experiences as them that are now being able to model for them in their peer role, somebody that they can go to when they have questions or concerns. And we want to prevent isolation and co-optation of the peer role. Co-optation is most commonly defined as professionalism. So it's adopting the values, attributes, and styles often associated with professionally credentialed staff. So we're with co-optation, it's really peers drifting more towards the traditional services, like the medical model. And so there's a a survey sample where 77% of workers in treatment organizations reported that they were supervised by treatment staff members. And because of that, they felt more confident in providing treatment. And it was like, it's great you feel more confident, but no. As peers, we don't provide treatment, right? We're providing a different type of service. And so we want to find ways that peers can really maintain their peerness. So the fifth item on our checklist is living wages and professional growth. And I think this is an elephant in the room people don't talk about. Peers are often paid less than other positions with comparable responsibilities. So at times, depending on the program, they may have comparable responsibilities to mental health workers, community health workers, case managers, service coordinators, things like that, but they're often paid much less, often underpaid. And I'm in Sacramento, California. I was driving to pick up one of my stepkids the other day, and Chick-fil-A had a sign out saying hiring $19 an hour. And I don't know about you, but I've worked in this field for a long time, and there is a lot of weight that comes with this work, right? It's not just, oh, I saw a client, but there's a lot of emotional weight. There is a lot of vicarious trauma. There are a lot of things that come with this work. And if I'm going to pick between, wait, you mean when I'm off the clock and I'm not worried about someone's life, versus I feel like someone's life is in my hand, I'm going to take that $19 an hour, not worrying about someone's life, right? So I think it's just important to recognize, like, we are asking people to be vulnerable, to treat people with often severe mental health challenges. And, some agencies we're still paying our peers minimum wage. And so I was recently having a conversation with Stanford, and they asked me, well, how much should we be paying our peers? And I started off by saying a livable wage. MIT has a tool where you can click on county, and it will tell you what a livable wage is in that county. So for example, in Santa Clara County, a livable wage for someone with no children is over $30 an hour. And that doesn't matter what the job is. Like, that's what they're saying, that is a livable wage. With a child in Santa Clara County, a livable wage is $50 an hour. Right. And so I think moving away from, oh, well, here's how much, it's $25 an hour. That's a lot. But then when you think of inflation, rent, gas, utilities, food, all of the things that people are having to pay for, like, we have folks that are really struggling. And I think that's why people debate, do I get off Social Security or do I stay on Social Security, right? Because I don't know that the wage I'm getting is not going to be a livable wage, right? And I have certain protections and guarantees under Social Security that I may lose if I take this full-time job. So it's, I think focusing more on a livable wage for everybody, but at the very least, ensuring that we're not getting paid less than other staff who have comparable responsibilities. So I got on a soapbox a little bit, apologies, I'll keep us going. We often see that peers are often restricted to temporary part-time or extra help roles. We've seen some organizations hire their peers through temp agencies. I don't think that's very common, but it is something that we've seen. We've also seen a lot of counties hire their peers as extra help. And when you're hired as extra help, there's a lot of benefits that you don't get if you're hired as kind of a regular county employee. We've often seen a lot of organizations who only hire peers at part-time. And so all of those things are really limiting higher compensations, opportunities for professional growth and advancement. And I think it limits our ability to retain really qualified staff. And then most agencies don't provide opportunities for growth in the peer role. Right. I've heard years and years and years and years. Oh, if you want to move up, you should go back to school and you can become a case manager or social worker. And it's like, well, what if I want to stay a peer? What's that next step, right? Maybe I started as a volunteer on a warm line or at a wellness center, right? And then I started working part-time, and then I became a full-time staff. And then I was able to become a team lead and then a supervisor. And then I became the program manager. And now I'm, middle management, or now I'm going to actually move into the quality improvement department and start working on data and research and really incorporating my lived experience voice into those decisions that are being made, right? So when we're talking about career ladders, professional growth, It's a ladder. It's not 2 or 3 steps, right? Just like any other profession. And it's really, I think we lose a lot of good people because there isn't that next step available to them. All right, a few more slides. So with, excuse my typo, with expanding peer employment, we want to think about, some peer roles are entry level, but we also have advancement opportunities, right? So we might have, I kind of mentioned these, occasional volunteer, regular volunteer, extra help, part-time, temporary, maybe they're at a wellness center, they do outreach. But then we can also have team leads, managers, supervisors. They could be a patient's rights advocate, be part of a cultural competence team, work on quality improvement, be a mental health director, right? So if we're really thinking about peers as a career, they can go anywhere. Well, how are we designing that career ladder, and how are we creating a pathway to get there, right? Peers need their own pathway, whatever journey that looks like. And then the 6th item on the checklist is that we want to ensure a direct line to leadership, and to ensure the position, program, and work activities align with the intended vision and organizational values. And sometimes we have folks up high that will say, oh, we really want to do this. This is our goal. This is where we want to get to. But the line staff are the ones that often are the ones that make that happen. So we want to ensure that peers have a direct line to leadership, whether it's a peer manager who has direct line to leadership, but that voice is at the table where decisions are being made, where people are getting together and having conversations, having debates about what we want to do, what direction we want to go, what data is being collected, what the next step is, and ensuring that the lived experience voice is at those at that table to ensure that we're being recovery oriented in making those decisions, and we're putting our clients first. And we also want to ensure that we're having peers connected to leadership to prevent and address issues such as stigma, discrimination, harassment, bullying, co-optation, and role confusion. So that was our 6-item checklist. So we talked about assessing your organizational competencies and work culture, working with existing staff, using a slow and methodical integration process, hiring more than one peer in a program, ensuring peers make livable wages and have opportunities for professional growth, and ensuring peers have a direct line or report directly to a high-level administrative staff. I know we just have a couple of minutes left, and I just threw a whole bunch of information out. So if you have any questions, please throw them in the chat, and we will ensure that we get you any of the handouts that I discussed, so you can look into this topic more thoroughly. I just wanted to go through at least what I see here right now. Let's see. Somebody said, we want to avoid power differentials, stress that peer services are voluntary, and we work with the participants' agendas. With role drift, sometimes supervisors can fall into the therapist role with peer supervisees. And I think that's an issue that does come up. I did not talk about it, but working with existing staff is important, because when you bring on a peer staff, they are not your client, right? It is now an employer-employee relationship. And I think when we fall into that, like, oh, I'm acting as their therapist, it reinforces the idea that, oh, we need to handle the peers with kids' clubs. They can't really handle all of this. We need to take care of them. And so again, I think working with existing staff for them really to understand what their role is with the peer. We see Carrie says, I've advocated for peer support professionals to be paid the same as case managers with BAs after they complete peer support professional training. Kimberly says, I'm not paid what I'm worth either. I'm fully licensed and have specialty credentials. This is a talk for the insurance. Yeah, definitely. Also true I think about changing jobs, like getting full-time jobs. If you're on Section 8 or supportive housing, right, that's a threat there. Am I going to be able to afford my rent if I go take this full-time job? Carrie said, again, most folks in human services are way underpaid. Totally agree. William said, what's really scary is many organizations see inexpensive peer workers as the means to expand services. We've seen that. Patrice says advancement opportunities look awesome. Do we have resources for job descriptions? So I would say if you are interested in more resources or job descriptions, you can shoot me an email and I can see what I could do about getting you specific information. I think that was everything in the chat. So I know we're right on time. It's 10:59. If anyone has any questions, you can contact me directly. I will hang out for a little while. I see an iPhone has their hand up, but I don't know who you are.
Hey, Stephen Ebonimali, from Sally's Place in Hayward, La Familia. Thank you so much, Stephanie, for your class. It was brief, it was concise, it was everything. I really liked the story you told about the office and this peer support specialist all in a cubicle. It was informing how even from the environmental factor to the psychological factor, a lot of integration needs to be done. Thank you, Ms. Stephanie.
Thank you for the feedback. I really appreciate it. So it is 11 o'clock. If you want to run and take your break, go for it. Like I mentioned, I will hang out just for a little bit in case anybody needs anything.
Thank you so much, Stephanie. Let me jump on the thing. My name is Brian, and I have posted the handouts. It's a zip file that you can download. Let me know if you have any issues with that. And also I put a link for a evaluation, and we really appreciate the feedback, as well as if you have any suggestions for topics for any of our next conferences. Again, Stephanie, so awesome. I learned so much, like, believe me.
Oh, thank you.
Thank you so much for joining us and doing such a great presentation. I'm going to put up the schedule for the next session. It will begin at 11:30, and that will be with Jason Robinson. It's peer hiring and career ladders, what actually works. So that sounds like a great one. I'm kind of looking up because I have another monitor up here. But thanks. Have a great day. I'm going to stick around here. So if you have any questions, you can go ahead and put them in the chat. All right. Thank you.
Hey, Stephanie, it's Kayla. Nice to see you, and thank you so much for the presentation. It's good to see you.
Oh my goodness.
I definitely enjoyed it. I actually have a question, and maybe you can provide some additional resource. So I work for Department of Social Services, and we are trying to define a stipend rate for our youth that have a lived experience. And so I'm wondering if you have any resources or where we can try to define a livable rate. Thank you for that. Thank you for the website you had stated as well.
Yeah. So Kayla, so when you say a stipend, so they're not employees?
No.
Okay. So one thing that you want to be careful of with stipends is that you do not want it to be an hourly stipend, because then that is considered a wage, and it's cloudy, legally, whether are they an employee or are they not an employee.
Okay.
So you would kind of want I know that we've had interns in the past and they get a stipend and it's here's your monthly stipend. Mm-hmm. Volunteering between this many hours and this many hours. So then it's not tied to a rate per hour. So I think that's something to be careful of.
Okay.
So you're saying anticipate how many peers or hours they will be working and then kind of base it off of that.
Yeah. And you just want to be careful about not let's say right now, I don't know what minimum wage is. Is it $15 in California?
15. Yeah.
Yeah. So you don't want to be oh, it's 10 hours. So we're going to give them $150 for 10 hours. And then it's well, wait, that's $15 an hour. So you kind of want to be thoughtful and almost a range, 10 to 15 hours a month, you get $150 stipend or something. So it's not directly tied to an hourly rate.
Okay.
And I'm sure people will pick, depending on how much they want to do, it might pick the lower amount of hours, but just to be careful so that there's a clear distinction, like you're not an employee, this is not an hourly rate, things like that.
And that's kind of the same with contract work as well, right? So for an example, I like to have a wide variety of peers with different lived experiences, right? To match all of the different people, but I want to contract with them. So they get a particular amount, like, you know, $30 an hour, right?
Yeah.
But then when you contract with them, you're going to 1099 them. But my understanding is that you can't contract with them if they do not do other peer services somewhere else. Like that's not their job. Like I can't say they're a contractor if they don't do it somewhere else. Does that?
That I don't know about.
Oh, okay. Okay. I'm trying to get a workaround about hiring full-time or part-time staff. Yeah, maybe they're only going to have 2 peers. And so I want to pay them for those. I want to pay them an hourly rate.
Don't know, there's some kind of weird feedback going on.
I know I sound like, you know, Purple Haze days. Wow. Oh, okay.
Yeah. The hourly, you just want to, if they're not employees, you want to be very careful with assigning an hourly rate. Just very, like you could pay a certain amount per day, a certain amount per month. But I would be careful on the hourly piece.
Okay, thank you.
And Kayla, can you, I'm going to put my email in the chat. I was going to say, if you just shoot me an email and I can look a little bit into like what would be a stipend amount that would be livable, I guess.
Okay, thank you so much.
No problem. So nice to hear your voice.
Yeah, good to see you.
So can I ask Stephanie a question from social services?
Absolutely.
So are you trying to navigate having people that you work with become peers to then mentor other peers within the social service agency?
Are you talking about clients, peer, or sorry, I don't know that I understand the question.
Did I freeze? Oh,
Am I here? Oh, Susan, I wasn't sure if I understood the question.
oh, I was asking the social service person, the one that just spoke to you. Kayla.
Oh, gotcha. Yeah. So we're not trying to employ, we just want to bring them to the table to have their voice, shared regarding to like the policies and things that we create. So they'll be, a part of focus groups or maybe reading some documents to make sure it's, friendly. So a variety of different things.
Okay. Do you use peer services in your county?
Sacramento County, yes, we do have peer services.
Are they tied to RAP services?
I would say some are RAP, FIT, so a variety of the system of care.
Okay.
Yeah.
Thanks.
You're welcome.
And Kayla, now that you were more specific, like with the stipends, like it might be, this is the stipend amount to attend a focus group. This is the stipend amount for this activity without, because then it's not like an hourly thing at all. It's just like anybody who does this activity, if they do a focus group, everyone gets $30 if they do a focus group.
Okay, so like breaking it down or into like different
For activity.
Gotcha. Okay. Thank you. It really helps me. I appreciate it.
Absolutely.